Hello, and thanks for joining us for this video case tip. I'm Bryn McBride of ABC for Health. Today we're continuing our conversation on the Affordable Care Act executive order that was signed on Inauguration Day. We started our conversation on this topic before with a brief summary of what the executive order said. Today we're going to look a little bit more at the flexibility the order gives to some of the states, what that might look like over time. As a reminder, this was signed, one of the new president's first orders of business. It instructs the federal government to dismantle the Affordable Care Act, but only to the maximum extent permitted by law. It was meant to direct agencies to waive, defer, or grant exemptions from or delay any taxes or penalties, and agencies are supposed to dismantle any provisions that would impose a fiscal burden on a state. Now, the order itself is starting to create this pattern that we're seeing through some of the most recent actions that give the states a little bit more responsibility and a little bit more flexibility, while there's an overall theme of trying to do some deregulation at the federal level. What does this look like when it comes time to this executive order? Well, it starts looking at the flexibility when it comes to the Affordable Care Act and Medicaid, and we'll get to that in just a second. But let's remind ourselves that this takes time, not only because of some of the provisions that the Affordable Care Act and protections that are in place, but because of the people that need to be in place. We need a Secretary of the U.S. Department of Health and Human Services, Treasury Secretary, Labor Secretary, CMS administrators, and an IRS commissioner in place before any substantial changes can be made. That's going to take a little bit of time. Not a lot, but a little bit. So that gives us some breathing room right off the bat. Second, let's look at what more of this flexibility would actually look like. When agencies are supposed to defer to some of the state actions and give them a little bit of flexibility and break on the burden of cost, this could translate into what are frequently determined as waivers to the states. Now, there are a couple different waivers we're talking about. Let's start first with the individual responsibility requirement. Right now, everybody has to purchase insurance or have minimum essential health coverage or pay a penalty. This is the individual mandate provision of the Affordable Care Act. There's a little flexibility written into the law that says if you have a hardship, you don't have to have private insurance or minimum essential health coverage. Now, the little bit of flexibility that this executive order might be giving us is broadly or more liberally defining hardship. Now, remember, you have to still define it within the confines of law. Not wanting insurance is not a hardship that would grant you an exemption from purchasing insurance. So there's a little wiggle room there, but not too much. That might be one instance we're going to follow in the coming weeks. There are other waivers, though. Section 1332 of the Affordable Care Act contains what are called state innovation waivers. That lets the states be creative and innovative on how they want to play out or introduce or amend the way that they run their marketplace and other Affordable Care Act provisions. Again, this order giving the states a little bit more flexibility and letting the agencies defer to the states a little bit more might mean that they more liberally interpret what innovation means. So that's another place where we could see a lot more flexibility, something to keep our eyes on. The last waiver we might want to pay attention to are Section 1115 Medicaid waivers. These are state demonstration waivers where the state can show how they can cover more people or run Medicaid a little differently to ensure good outcomes. Now, they have to be budget neutral, but it is, again, an area where the states could take a lot of control, make a lot of changes. Some of the changes being proposed right now in the state of Wisconsin in the next executive budget will have a lot of changes that could come about through Medicaid 1115 waivers. Different provisions added to the way that public benefits are distributed or different services are administered could be included in that. Now, again, it does have to be budget neutral. That would have to be proven, but there would need to be somebody that was watching to make sure that that was happening. So enforcement would also have to be in place. These are the kinds of waivers and flexibility we're going to keep our eye on. We'll be learning more, of course, in the weeks to come. If you want to read that executive order, we give you the link to that in the information button. We also share a blog post written through Health Affairs that explains a little bit more and gives some predictions of what might be to come after this Affordable Care Act executive order was signed. If you want to tell us your Affordable Care Act story, you can do so by clicking on that information button and sending us an email or visiting our website at healthwatchwisconsin.org. Thanks for joining us.